this is Angela Gartner, editor at Northeast Ohio Parent Magazine, and welcome to our 2023 Summer Safety Talk Series. We are here with Heather Trnka. She is the Injury Prevention Supervisor at Akron Children's Hospital. Welcome, Heather. We are so happy to have you here today.
Thanks, Angela. I'm happy to be here.
Well, this is part two of our series, and we are going to be discussing the outdoors and how to keep children safe in nature. So, the first question is many children are enjoying hikes and other activities this summer. So, how should parents really prepare their children for these adventures?
It's a great question. We're so lucky to be in Northeast Ohio where we have the Cuyahoga Valley National Park and really great metro park systems that give us an opportunity to get out into nature, to hike, to have fun, to do fun things together as a family. And so one of the things we need to take into consideration when we're heading out for those hikes is making sure that we're protecting ourselves from bugs. And we've seen a huge increase in tick related coming to the hospital. And so I'm going to give you some tips and tricks on what to do to prevent those nasty bug bites and tick bites from happening while you're out on that hike. So one of the things that we would recommend is long sleeves and long pants, which that can sometimes be a barrier when we talk about, our hot summer days here in Northeast Ohio. Bug repellent with DEET is appropriate to use, especially as we go into the national parks where we've seen that increase in tick related injuries. And so making sure that we're applying that to both ourselves and our kids, and making sure that our whole bodies are covered. And so another great alternative is wearing a hat because those bugs can drop from trees, and making sure that we're as safe as we can be when it comes to preventing those bug bites. Now, after our walk, we want to make sure that we're checking our bodies, especially our little people who can't check themselves. And so if you've traveled around in shorts, we want to make sure we're checking all of our body, including in our hair, as well as around the groin area, because that can be an area where ticks can nest.
Why is it important to check for ticks?
So Lyme disease is a real thing, and we're seeing increased cases of that across Ohio. So we want to make sure that if there is a tick bite, that we get the tick removed as soon as possible. You can do that yourself. There's some great videos out on YouTube on how to remove a tick. But if you're having issues, you can come to one of our urgent cares for help with that.
What are some common bug bites or bugs that people see that are biting people around besides just ticks?
Yeah, so we always have mosquitoes. They're such a pest, right? And so there's some things that we can do to prevent mosquito bites, wearing light colors, again, wearing bug repellent. Some people have a greater reaction to mosquito bites than others. And so whatever you can do to help relieve those, whether it's some aloe, some old wives' tales, whatever feels right for your family. But, unfortunately, we can't always avoid those bug bites when we're out in nature.
So what's like the best treatment for bug bites and when should you really, seek out a professional help?
Bug bites can sometimes have a varied reaction depending on the child. And so if you're having a large reaction, a lot of redness, the redness is spreading up the arm or down the leg or wherever that bite is, that might be the time to reach out to your medical provider. We have some great physicians at our Akron Children's Hospital pediatrics groups that I'm sure would be more than happy to see your child when it comes to examining those bug bites that look more severe than others.
And back to the ticks, like what are some of the symptoms for the Lyme disease? And, when should, after a tick bite, when should you feel concerned about it?
So we want to keep a close eye on all tick bites. So if we remove a tick, we want to keep our eye on the area. Sometimes they said that there's a bullseye pattern that happens around that tick bite. That doesn't happen for everyone when they have Lyme disease, but that's kind of one thing that we want to keep a close eye on. If you have the developing rash around a tick bite, we want to make sure we get to a medical provider right away. Now, that doesn't mean you need to go to the emergency room, but you can certainly try the urgent care or your primary care physician.
Now, we talked about bug repellent, but what are the ages really for bug repellents? And, what kind of safety tips do you have around using those bug repellents?
So the bug repellents are really great for all of our kids who are walking. The one thing we want to remind parents though is make sure that you're taking a shower after or shower or bath after using bug repellent. We don't want that to remain on the skin for a long period of time. Also with aerosols, we don't want to spray aerosols right into kids' faces. They don't have that ability to hold their breath like adults do to prevent them from inhaling the bug spray. So one way you can do it is spray it into your hands and then wipe it on their faces. So you're avoiding spraying it directly into their face.
Is there any other tips that you want to give parents about exploring the outdoors safely?
I think that, one of the things is make sure we're keeping an eye on our kids. We've got some great trails all throughout Northeast Ohio. And so making sure that we're practicing trail safety. So we're staying on the marked trail. We're not wandering off. There's some lovely cliff sides throughout Northeast Ohio on those trails. And we want to make sure that our kids are staying safe. So good footwear, no sandals, no flip-flops, covered toes, and is covering as much of your body as possible to prevent those bug bites.
We would like to thank Heather for joining us again and for look for some more tips and view the whole 2023 Safety Talk series on northeastohioparent.com. Or to learn more about Akron Children's Hospital, go to akronchildrens.org. Thank you for listening.